Hello, everybody. Hello, hello, hello. You're all welcome. Good evening to you all. Yeah, hello, welcome again. Welcome, everybody. Thank you for joining us. Good evening to you all. If you are online, whether on YouTube, on Facebook, and you can hear me, please put a comment in the comment box. Let me know that you're with me. We are very excited to have you here today. Thank you very much for joining us. Yeah, I've got people joining us already. All right, keep coming, keep coming. We're going to be starting in a few minutes, and I trust that you'll be getting a lot of value for your time today. All right, so please keep joining us. If you can hear me, please let me know in the comment section. Let me know in the comment section, okay? Drop a comment for me. Let me know that you can hear me. You can drop your name and where you're joining us from. I've got all our speakers ready, great, amazing people who will be doing justice to the discussion of today. All right, like you already know, I believe you've seen the flyers that today we're talking about knowing your risk, and this is an event organized by the Diabetes Nigeria team. We we are doing this in commemoration of the November 14 World Diabetes Day, and it's a day that has been set aside by the WHO to commemorate, to celebrate, and to especially put a spotlight on people living with diabetes and everything that has to do with diabetes care management, right? And for this year, the theme is knowing your risk, and that's what we're doing justice to today. We've got very amazing people, intelligent, smart people who will be doing justice to the discussion of today. All right, so if you're in the comments and you can hear me, we're going to be starting in a few minutes from now. All right, you can just share this with everyone around, share this with your friend, all right, and let them know that we're starting right about now. Let them know we're starting right about now, and do well to as well share this with a friend, share it with someone on YouTube. You can tag somebody in the comment section, someone who needs to be here, whether they have diabetes or they don't have diabetes. um, they can definitely learn something from this section, right? And the very good thing is the content of today's discussion, it's all encompassing. We're not just talking about diabetes. As for those who have it alone, we're talking about the risk. So we're trying to see how to help a lot of people even prevent diabetes. I mean, doing what it takes to not developing diabetes. And that's what we are after today. All right. So once again, if you can see me, if you can hear me, please let me know in the comment section. I'm right here seeing your comments, and yeah, I'm happy to read out your comments and to welcome you to the live stream. Thank you, thank you. If you're here, let me know. On YouTube, I can see two people right joining us on YouTube. Please let me know if you're with me. All right, in a few seconds, maybe a minute from now, we're going to be starting fully. Oh, it's just about time to start now. So I'm going to be bringing up the first speaker. If you've seen the earlier advertorial I rolled out, we're going to be having four amazing speakers. The first person in person of Dr. Timi Okutoye, who will be talking to us about the nitty gritty of diabetes itself, what it is all about, what is the cause, what are the risk factors, what are those things that what does it entail in the real sense, um, and then help us to understand all of that. And then we'll go on to having a pharmacist who will be discussing in depth what the drug management of diabetes and how you should um, manage it and prevent anything and that could result from the misuse of drugs. We'll be having a dietitian who will be dealing with issues around diet. So if you want to know about your diet and diabetes, you can stay tuned, and that will be coming up soon, right? And then we'll be having a nurse and a mental health specialist with us on to discuss with us on the mental health issues that relate to diabetes, tobacco smoking, alcohol, and how to just get ourselves um, fit mentally. And for those who have diabetes as well, how to be able to prevent some mental health issues that are associated with diabetes. So that's what we are here for. And I'm so happy, I'm so excited to have you all join me today. Thank you very much. Once again, my name is Damilare Jonathan Arolo. I'm a registered nurse and a diabetes educator, and we'll be starting right about now. And I'll just play the advertorial again. And the next voice you'll be hearing is that of Dr. Timmy Ogutoye, who will be speaking to us quickly. And just in a minute, she'll be just coming up. Um, but before then, I'm just going to play this short advertorial for those who are joining to join and to know what it is all about. Hello, Dr. Timmy. Thank you for joining me. I hope you can hear me very well.
Yes, I can. Hello, everyone.
Hello, hello. Thank you
Thank
very
you,
much.
Nurse
So I'm just going to
Jonathan.
put you on the spotlight right now, okay? And then you can
Okay,
go
that's
ahead. Thank you very much.
yep. Hello, everyone. I'm Timi Oguntoye. I'm a doctor, and I'm glad to be here again. So we had this program, I think, last year. It was a stream on, oh, was it stream now? I've forgotten what they call it on Twitter Space. Yeah, it was Twitter Space, and it was it was nice actually talking about diabetes, the management, and we had a lot of input from people, people that were newly diagnosed, people that have been living with it for a long period of time, people that know people that are living with this disease and are managing it, and it was nice to be among that. And I'm glad to be here again, doing this again 1 year after. So thank you for joining. Thank you, Nurse Jonathan, for hosting this. You're doing great work. And that's it. So about diabetes, mainly we're going to be talking about type 2 diabetes here because that's the one that is kind of modifiable. But about diabetes in general, diabetes mellitus, that's the one we're talking about because That's the one people know about. And when people talk about diabetes mellitus, we're talking about increased blood sugar. So say, you have high blood sugar, you have diabetes. You have high blood sugar, you have diabetes. It's not exactly like that. There's a diagnostic criteria. It has to go above a certain level persistently and with or without complications. They leave that to the medics to look at the criteria. But high blood sugar, hyperglycemia, that's what diabetes mellitus is. And it happens as a result of when there's a problem in the metabolism of carbohydrates and of food in general, because there are some other food components that have some bits of the end product is sugar. And then when the sugar is not being utilized by the body, it builds up in the blood and gets past a certain level and then causes damage to different tissues in the body. And that's what hyperglycemia is, that also known as diabetes mellitus. And the major thing is there are two types, major types. There are other so many different types, but the major ones that are the type 1 and type 2. And the type 1 is the one that is usually genetic. That's the one that you really cannot modify the risk factors. But type 2 is the one that may occur maybe as a result of some other risk factors that I'll be talking about later. And there's this other one, gestational induced diabetes. What it basically means is that some people get pregnant, and when they are pregnant, the metabolism of sugar is somehow affected, and that causes the blood sugar to go up. But usually, it should resolve after pregnancy, but that also kind of puts them at risk of having type 2 DM later in the future. Doesn't mean they will have it, but puts them at risk. So the one we'll be talking about majorly today is the type 2 diabetes. And what happens in type 2 diabetes is that there are some cells in the body, in the pancreas, that produce insulin, and this insulin help the body tissues to absorb sugar, to absorb glucose. But when this insulin is not being produced enough, or the body doesn't react properly to it, that is, the body doesn't realize that the insulin is there, or the body can't utilize the insulin effectively, then the sugar builds up, and then that's hyperglycemia, diabetes mellitus. So that's basically what diabetes mellitus is as per introduction. So what are the risk factors of this diabetes? What can we do to prevent it? What can we do? Or what are the things to look out for? Yes. So there are modifiable risk factors and there are non-modifiable risk factors. Let's start with the non-modifiable ones. So someone with the family history of diabetes, especially um, maybe your parents or your sibling, that's a risk factor. And there's really nothing you can do about that. You can't change your parents, you can't change your family members, but that just means that you have to take some things more seriously. That means that you have to take the modifiable risk factors more seriously and try to reduce your chance of getting that, or the reduce the or increase the amount of time it's going to take for it to happen. Maybe something is supposed to happen at the age of 20 and then it happens at the age of 40. You've been able to delay it a while. Yeah. So usually in the past, we used to say age was a risk factor, like the elderly. Diabetes used to be a thing for the elderly, but it's not so these days, actually. So many young people in their 20s, even people less than 20, are coming down with, or they are being diagnosed with diabetes mellitus. And so it's no longer a disease of the elderly. And that's why we have to create awareness about it. That's why we have to talk about it so that people know about this. And also the people that have um, diabetes, they can learn how to manage it. And also, if you have family members, you have friends, you know how to support them and how to help them manage this disease. So age is no longer like a very significant risk factor like that in this in the sense of things. But another risk factor is obesity. Now, that could be a reason why younger people are coming down with this, because increased when there's increased BMI, that's your body mass index, when it's raised, when there's weight gain, when there's a lot of fat tissues, there's in the absorption of insulin and in the production of insulin and in the utilization of insulin, hormones begin to play up and down, and then the sugar metabolism is disturbed and things happen. That's why also people with hormonal problems, PCOS, they might come down with things like hyperglycemia. And that's why they'd say one of the management of PCOS is to manage the weight gain, and they can manage the sugar and things like that. A lot of people are going through different things, and it is not easy treating hormonal problems, trying to get your weight in the right bracket. It's not easy, but these are things that we have to do just for ourselves, to so that we can live a, a life with better quality, and we can go on to do other things. Like you can, that's it's when you're feeling fine, is when you're doing well, when you're healthy, that you can do well at your job, that you can have good relationships, that you can travel and do things. So that's that. Weight gain is a modifiable risk factor. Another risk factor is the smoking. Yeah, smoking. It's, I don't know if it's getting more I don't know, common or not. But then there's vaping, the other one too. So smoking, vaping, also drinking alcohol. These are risk factors that are modifiable. If you're doing any of these things, you can try to cut it down. You can seek help with social communities, and they can help you cope that, so that that will reduce your chance of having diabetes and other health problems. There are so many health problems attached to that. So also, if you're of black descent, Africans, Asians, there's nothing you can do about that one. That's a non-modifiable risk factor, but it does put us at risk. So having a positive family history, being black, those are already two risk factors. So if you're smoking and you're drinking, that's just adding to it and increasing the chance of coming down with diabetes mellitus. Enough of the risk factors. What are the symptoms? How do you know? Sometimes you might not know, because type 2, most people really don't know that they have diabetes until maybe they get really sick and they go to the hospital and they are being treated, and they have to check the blood sugar, and they say probably you're having these symptoms because the person has diabetes, or the person's blood sugar is high. And by that time, a lot of damage is being done to the tissues. So, what are the symptoms? Number one, you could notice that you're eating more frequently than normal. Polyphagia, these days I'm just eating more and more. You're eating 5, 6 times daily. And really, it's because you're hungry. It's not because you just feel like eating, but you're really hungry and you're eating more. And it's not like you need this food. Like maybe the amount of food you eat to the amount of exercise or the work you do, and you're just eating more and more and more, and you're not pregnant, and it's not like you're doing more work physically that you need more calories, but you just end up eating more and more. That could be a sign. Also, polydipsia. I know Nigeria is hot. You're drinking a lot of water, but then you notice that you're drinking more than 3 liters. You are drinking 4, 5, 6 liters per day, might be a sign. Polydipsia is a sign. Also, and that's because there's increased thirst too. So it's not because you just, if I give you a jar of water and you're not thirsty and I tell you to drink it, you probably will be bored. Why? Water is not sweet. Water is not really exciting like that to drink. But then you end up drinking in excess. That could be a sign. Another sign is that person someone could start having recurrent skin infections, recurrent boils, one boil here today, another boil here tomorrow, another boil here next tomorrow, and you're wondering what is happening. Different yeast infections in different crevices of your body. So those, that could be a sign that, oh, there's something wrong with the sugar metabolism, because all these organisms, there are some organisms naturally that on our skin, in our body, they are there normally. there's nothing. This is not about whether you're clean or you're not clean, or you're taking your bath or you're not taking your bath. But then these organisms are not meant to cause infections, but by the time they start causing recurrent infections, could be a sign that, oh, there's a break in the immunity, in the protective barrier, and that could be because of diabetes mellitus. Another sign could be that when you go to pee, you notice that, well, this one is not very common, but people, you could notice it also. Maybe you go to pee in the toilet and your urine is just foamy, like you pour detergent in and mix with water. So you just see that the urine is getting foamy a lot, and this is not your usual. This is not normal. So that could be a sign. Also, recurrent urinary tract infections. That's not something that anyone should be having. So it could be a sign that someone has diabetes mellitus. Weight loss, weight gain. Well, those are not in type 1. Maybe weight loss could be one of the symptoms, but in type 2 is not so much significant like that. So um the major ones, also there could be visual disturbance. Suddenly vision just gets worse, and it's not like you're aging, you're not in your 40s, you're not in your 50s, and it's not like you've been using glasses before or anything. You just notice that you're not seeing, your vision is just getting blurred. It could be as a result of the blood sugar being elevated. So aside the symptoms now, we'll talk more about symptoms when we get to complications. What are the things that can be done to manage this disease? So you get to the hospital for whatever reason, you're having symptoms, or you're just going for a regular health check, and they check your blood sugar and they're like, has anyone ever told you your blood sugar is raised? And you're like, no. And they're like, okay, maybe you should go to the hospital. That's Most people ignore that sign. And by the time they are coming to the hospital presenting with whatever symptom or disease, and it has flared up, and you're asking them, has anyone ever told you that your blood sugar is rising? I'm like, they told me one time I went for a medical outreach, or one time I went for a health check, but I just thought it was nothing. No, that is the wrong move. Anytime you do an health check and someone tells you your blood sugar is raised, please and please do not ignore it. Please and please, I'm begging you, do not ignore it. It's better for you to get to the hospital and for them to check and say, oh, there's no problem, or just come back for another health check in another time, than for you to ignore it and a lot of problems are going on, and some of them life changing, some of them permanent, and we wouldn't want that to happen. The earlier, the better. The earlier is diagnosed, the better for you, the better for us, because early diagnosis, early treatment, that's what will make the life of the healthcare worker even easier, because we know we can counsel you, we can monitor you, than we starting from the complications of the disease. So please and please do not ignore you're having symptoms, not ignore your health. You have a family issue, or even if you get diagnosed with it, please talk to your family about it, talk to your friends about it. Why? Because remember I said having a positive family history is a risk factor. So imagine you're not telling your siblings, you're not telling your parents, you're not telling your children, you're putting them at risk and they don't know, and that's kind of unfair to them in a way. Also, if you let them know, they can support you, because in the management of diabetes mellitus, there's the dietary changes, there's the lifestyle changes, there's the exercise, and so many things. These are people that can look out for you. These are people that when you're having, they can know about the signs of the complications. When you're having either a crisis due to high blood sugar or low blood sugar, they can look out for you, call an ambulance for you, remind you about your medications, just to make your life easier. So please, if you get diagnosed with it, you need social support. The importance of social support cannot be overemphasized. Just like being diagnosed early and starting treatment early is very important. So one, we've spoken about diagnosis. Two, we've spoken about social support. The other thing now is the treatment. In the treatment, for some people, they may say, okay, let's just watch your diet, and the dietitian is going to talk about that later on a grander scale. And that in itself, treatment has started. Some people be like, I'm not using any medications. treatment hasn't started, or treatment has started even right from the diagnosis. Treatment has started. Counseling is part of treatment. Dietary modification is part of treatment. Medications and using insulin is part of treatment. All part of doing health checks, checking your feet for wounds and all of that. Even the social support is still part of treatment, because this is something that is not going away anytime soon. I believe in miracles, and yes, God does heal people. But pending that time, and while you're waiting on your miracle, it's very important for you to take management very seriously. So, yes, we've talked about um, social support, we've talked about early diagnosis, and we've talked about what else I've talked about? Sorry, I forgot. So yes, treatment. Now there's the injectables, that's the use of insulin, and there's the tablets. The pharmacist is going to talk to us more about that. But things to look out for, please. The advice that comes with the medications very important. If they say take before food, don't take after food. If they say take after food, don't take before food. If they say take once a day, don't do TDS. That's 3 times daily. If they say 3 times daily, don't do once a day. Don't skip your medication and do a double dose. In fact, that's like putting yourself at risk. Don't fast yourself unnecessarily and say, oh, so because I fasted myself, I'm going to skip this dose. If you've not been advised to do so, the management of diabetes is solely based on a good glycemic control, a good glucose control. And you can only have a good glucose control when you're watching what you eat, how you take your medications, and the lifestyle modification, even down to the timing you take your medications, very, very important. Because the complications of diabetes mellitus, maybe we should just go into that. Complications of diabetes mellitus can range from hyper to hypoglycemia. So the blood sugar is too high, problem. You treat excessively, blood sugar is too low, problem. So there's a range. The body needs sugar to function, but excess of it is not good. And when there's not enough, it's a problem. So having a good control is the key, is the key. So please and please, I'm going to take this moment. It seems like I'm begging, but the reason why I'm doing this is because you see so much people, so many things that could be avoided. Diabetic foot ulcers that could have been treated. Don't ignore any wound. You see one tiny wound is not, or just one bone infection, and one small tiny ulcer, and it's not healing. So, my enemies, people are doing this, people are doing that. Could just be something that treatment, medications, good skincare, good ulcer care will take care of. And ignoring that small thing is something that will flare up and cause problems, even to the point that a whole limb can be amputated. Seeing people, both limbs, more than two limbs have been amputated, and this is something that could have been prevented. It is a disease that is going to be managed for lifelong, lifelong. So yes, it can be a lot to take in. It is a lot to take in. From the diagnosis, you will get tired. It's not easy watching what you eat, taking medications every day is not easy. But the way to not get tired is when you have good social support. Do not ignore your clinics. When you go to clinics, the reason why you're going to clinics is not only just for the health checks, it's just so you can get encouraged. If there's a new medication, you won't know if you don't go. Because imagine you're taking two, three pills and there's just one pill that could do the job. It's just like putting yourself through all these troubles. And when you go to clinics, in fact, there are clinics dedicated to diabetes. It's not just you go along with everybody. So this is diabetic clinic, and there you have dietitians, there you have pharmacists, there you have nurses, there you have even the mental health team. They are there to support you and give you everything you need. Sometimes they give free drugs, they give free treatment, they do free screening, a lot of things that you can miss out on if you don't attend all these clinics. So please and please, you've done well by coming here, and thank you very much. I appreciate you for joining this program, but you can do better. You can take it forward, talk to people about it. You know people about it, support them. I mean, you know people that are diagnosed with diabetes, support them. You've been newly diagnosed with diabetes. I'm very sorry that this is happening, but it is something that can be managed. I've seen people 20 years, 40 years, and they are doing well, doing very well, doing very, very well. Being diagnosed with diabetes is not a death sentence. It's something that can be managed, and we are here. People are here. People are around to support you. You just have to link into this support, and let's see how it goes. So, thank you very much for coming to this program. Thank you for inviting me to this program again. This is another year, and hopefully next year this will happen again. Thank you very much.
Thank you so much, Dr. Timmy. Yeah, thank you so much for that. I believe someone watching us has gotten something great, valuable, and I trust that you're learning already. All right, so I'm just going to play a quick advertorial for for an interlude before we go on to have the pharmacist share one or two things with us on the drug management, how to best use your drugs to prevent some terrible things that could even happen with the use of drugs. It's so unfortunate that diabetes is incurable at the moment. Yes, there's a lot of work going on to find a cure to it, but hopefully soon we get a cure. However, pending that time, we need to keep taking our medications, all right? And for that reason, you need to know how to take it, when to take it, how to take it properly so that it doesn't even cause more problem to you. But before we go into that section, I'm just going to we're going to have a brief interlude, and after that, we'll come back to have our pharmacist to speak with us. That's pharmacist Adivisi Dagboyemi. Just before that, I'll play this now, and we'll be right back. Okay. All right, welcome back. Welcome back. So we've just had Dr. Oguntoye Tinlane shared with us on what diabetes is all about, and she has greatly encouraged us. One of the things I want to even buttress on was where she started talking about visiting the doctor, going for your clinics. It's very, very important, and I think I should just re-emphasize that with everyone watching us and that will be watching us later on, that you need to keep your clinic visits very, very serious. Take it very serious because that's the only avenue you have to be able to get the support you need. All right, and to be able to keep your blood sugar and everything that relates to your diabetes in check. All right, so we're going to go right on now to have the pharmacist share with us some of the things to know about the drugs. All right, hi, fam. Igbaboyemi, you can unmute yourself now, okay? Still muted. Can you unmute yourself? Great, great.
All right, can you hear me now?
Yes, very well, sir. Thank
All
you.
right, okay. All right. Thank you so much for this opportunity. I must say, this is actually a great event. It's a wonderful thing. It's good to see people that care about diabetes patients, and it's wonderful. This is my first time here joining this program, and I think I'm looking forward to next year's one actually.
Yeah,
And
yeah, thank you.
I learned a lot from Dr. Oguteye too. Wow, that was actually wonderful. So thank you so much for having me. All right, so we are going to be talking about diabetics or anti-diabetics. The diabetes drugs are actually called anti-diabetics. So how does these drugs work in the body? How do they bring about reduction in the blood sugar, and how does it work? And like she said, I'm going to pick it from where she said, talking about the fact that diabetes is not a death sentence. It's not a death sentence. And if you follow the usage of your drugs, of your medications, effectively and religiously, you will see that your the your lifespan is going to be well prolonged than what you think diabetes is all about. No. So the first thing actually is to be properly diagnosed. Before you even begin to talk about medications and all of that, you need to be properly diagnosed. There are different kinds of diabetes. You have the type 1, you have the type 2, you have the gestational, just like Dr. Guto mentioned earlier. So it's important for you to be properly diagnosed before you begin to talk about the medication, because the medication, well, is going to depend on the type of diabetes that you actually have. And basically there are two types. That's the type 1, the type 2. And of course the type 1 is when there is little or no production of insulin. You see, when it talks about the management of diabetes generally, and when you talk about the drugs, there is one particular guide that is important and that is insulin. Insulin is actually responsible for the movement of your blood sugar, of sugar from the blood into the cells to be used by the cells. And so when there is a problem with that insulin, that's where it's going to bring about either hyperglycemia, that's a high sugar level, or hypoglycemia. So, and the goal of treatment of diabetes is not actually just to reduce your blood sugar. People think that it's just to no, it's to bring your sugar level to the normal physiological range. It's to bring it to the normal physiological range. Uh, uh, so that you can that understanding is important, because there are some people that will just take their drugs and okay, since these drugs are there, let me just take more than the dose prescribed so that it can reduce this thing very well. No, no, no. You'll be doing yourself a lot of harm, because you're going to be it can get to the point of you being hypoglycemic, and that is also dangerous. In fact, that is even more dangerous than hyperglycemia itself, because it will it is the fainting will occur and all of that, and that will lead to death. So for the drugs now, we for type 1 diabetes, like I said, is majorly controlled by insulin, because there is no is either there is no little production of insulin or no production of insulin, and the major thing being used there is insulin for type 1 diabetes. And for insulin now, they are divided into different types. I'm sure you must have seen, like, there is what we call rapid acting. In other words, what that means is just like the onset of action is fast. In other words, like they work very fast. It's very fast. So if that is being used in case of when you need to crash a part, when the blood sugar is extremely high and you need to crash it down, they need to bring it down to the level, to the normal physiological range, so that it's not going to lead to complications of diabetes now. So that's what when rapid acting insulin are being used. And example is all this Lispro, Aspart, and then we also have what we call short acting insulin. That short acting, it means that they get to work within 2.5 hours. If you take short acting insulin within 2.5 hours, you begin to see the effect on your body, and then it lasts in the body for like maybe 4 to 6 hours. And we also have what we call intermediate acting. Example is NPH. Intermediate acting within 8 hours, it peaks within 8 hours. In other words, within 8 hours, you begin to see the effects, and then it also lasts in the body within 10 to 16 hours. And we have what we call long acting insulin. Long acting insulin. Now, there is a certain level of insulin that is important for to be in your body so that it can help you when it can help in the movement of your blood sugar level to be used by the cell for the sugar to move from the bloodstream into the cell. So there is a certain level of insulin there, and that's what long-acting insulin are given once a day. For people that have type 1 diabetes, it's more or less like a basal, and it lasts within 24 hours. All right, so let's talk about the type 2 diabetes now, because it's actually much more common, and it's important for you to know about the drugs aspect of it. So there are medications for it, and these medications actually, their goal is two things. It's either they increase the secretion of insulin, or they help your cells. Now they improve the sensitivity of your cells to the insulin in the body, so that they can make use of the insulin properly. So those are the two ways whereby they have. So their mechanism of action is either they help in the increasing the secretion of insulin, or they help your cells to be sensitive to the insulin that is being produced, so that they can make use of it properly. And the first class, I'm going to mention different classes now, but the first class is what we call the biogranules. And this is actually an example is made for me, and it's actually the first line of action, the drug the first choice of drug now when it comes to diabetes management, type 2 generally now. And what these biogranules do, that's the example made for me, like I said, what they do is that they stop the production of gluconeogenesis in the liver cells. That is, they inhibit hepatic gluconeogenesis. That is, they stop the liver cells from producing glucose, and in that way, it will reduce the glucose level in the bloodstream. So that's what they do. So what should you watch out for when you're taking your metformin? The adverse effects that is common to it. One of the things about metformin is that it reduces vitamin B12. It reduces vitamin B. In other words, it causes vitamin B12 deficiency. So it's good if you can, if you're on metformin, you can also take what we call, high vitamin B12, like all these nuts, B, Nirovite, Nirotes, for drugs that improves vitamin B12 now. So you can also take it there. And then metformin also brings about GI upsets. It upsets your GI, that is your gastrointestinal tract. It upsets it. So if you're on metformin, it's best to take it after food, because so that it will reduce that the effect or the effect on your GI, that is your gastrointestinal tract. And another thing about metformin, you need to avoid alcohol consumption, because especially for renally impaired patients, I mean people that have kidney issues, it's important for you to avoid alcohol consumption or reduce your alcohol consumption to the barest minimum. It's very, very important. Metformin can cause what we call lactic acidosis. It causes lactic acidosis, so it's important, especially in renally impaired patients. Now, it's important for you to watch your alcohol consumption. All right, let's talk about the second class. The second class is what we call the softening ureas, and that's example is glimepiride, glipizide, glipeclamide, and they're actually those ones that basically what they do is that they help to increase the release of insulin. They help to increase the release of insulin. And one common side effect of this particular class of drug is hypoglycemia. So you must follow the dose prescribed to you by your healthcare provider. You must follow the dose. I mean, it's important for you to follow the dose prescribed, so that you won't have to get to that point of you won't have to get to the point of being hypoglycemic. So, and another side effect is that they cause weight gain. Metformin, unlike metformin does not cause weight gain, and that's the good thing about metformin. But for softening urease and some other class of anti-diabetic, they causes weight gain. So it's important for you to know that. Another class that we talk about, meglitinides, the meglitinides, and basically they also function just the same way as softening urea. So it's just more of like the same mechanism of action together. So the same mechanism of action, there is no difference like that. They also bring about the increased releasing of insulin, though in a different kind of way. I'm not going to go into that aspects of the binding sites and all of that, but they bring about they increase the release of insulin, and they also cause hypoglycemia. Generally, anti-diabetic drugs cause hypoglycemia. That's the general thing that is common to all of them. So, and of course, it also brings about weight gain. So another class is what I call the DPP4 inhibitors. I'm sure you must have seen drugs like ninagliptin, saxagliptin, sistagliptin, all those gliptin like that, And what these DPP4 inhibitors do is that eh, they they work by inhibiting a particular enzyme called dipeptidase 4. So they inhibit that particular enzyme. Now, let me explain this in a way. When you take in something, when you eat, your body releases what we call glucan-like peptide 1. That's what happens when you eat something, probably just eat a cheese or you eat a bread or something. So your body releases what we call glucan-like peptide 1. And what this glucan-like peptide 1 do is that it stimulates the production of insulin and glucagon. It stimulates the production of insulin and glucagon. So when for okay, how will I put it now? Now, when you take this, okay, of course, you know that when it stimulates the production of insulin and then what is it called, glucagon, and in in diabetic patients now, there is need for production of more insulin. So, in order to bring about this more, how will I put it? In order to bring about more production of this insulin, and then this dipeptide peptidase 4. Now, what they do is that they inhibit this glucagon-like peptide. They inhibit it. And you know that this glucagon-like peptide, their release is what brings about insulin and glucagon. So immediately they inhibit it, it will bring about that production of insulin and glucagon. So dipeptide 4 inhibitors. Sorry that I'm explaining this, Meg. I just want you to understand that I have an idea of the pharmacology. So it makes it more interesting, when you know how the drugs they are taking, when you know how it works, it makes it more interesting. And I believe it should also improve compliance. You should be able to take it and like, oh wow, this is it. This is how it works and all of that. So that's why I'm just trying to explain the pharmacology a little bit, And so this dipeptide 4 inhibitors now. So it's inhibits this particular enzymes that breaks down this glucagon-like peptide. So when it inhibits this when it inhibits this that DPP4, when it inhibits it, it brings about that glucagon-like peptide to release insulin. And so that is what it does. So what should you watch out for when you're on this particular drug? Example is all this linagliptin, saxagliptin, sistagliptin. What should you watch out for? You need to watch out for urinary tract infection. It actually causes urinary tract infection. It also brings about respiratory infections. And also the one thing common to them is also joint pain. Joint pain is common to people using this drug. You may experience joint pain. Not everyone, but some people on these drugs may experience joint pain. Okay, now number 5, the other class of drugs is what I call glucagon-like peptide 1 agonists. Like just I say, I've talked about that initially about glucagon-like peptide. So agonists, these drugs actually, brings about the release of insulin and glucagon, and in that way they can bring about the reduction of your glucose in the bloodstream. An example is exenatide, linaglutide, and basically their adverse effects is inflammation of the pancreas. Inflammation of the pancreas. So it's not everyone that gets to experience that, but some people get to have that experience. That so you can be calm because your healthcare provider will have appropriately diagnosed it and know the one that is actually fit for you. And another class of anti-diabetics that is being used, and I mean it commonly now, is this one is being prescribed. I think its effect is very, very good. Is the what we call the SGLT2 inhibitors. That's the sodium glucose co-transporter inhibitors. And what they do is that, this particular enzyme, this sodium glucose co-transporter, it's the one that is responsible for the reabsorption of glucose, from the how will I put it now, from the urine back into the bloodstream. So inhibiting these enzymes now is going to bring about the uh, how will I put it, excretion. It's going to bring about excretion of glucose away from the body, and that will reduce the glucose level in the bloodstream. So it's a example is dapagliflozin, and it's very good. And the adverse effect, like I said, it's glucosuria. That is, you can see glucose in your urine. If you're on that drug, there is that high probability of you seeing glucose in your urine. Another thing is UTI, that's urinary tract infection. You can experience urinary tract infection because its mechanism of action is relating to the um the urinary tract system. Now that's where it deals with, so it's likely for you to experience urinary tract infection. And also there is this vaginal yeast infection too. If you're on that particular drug and then you've been experiencing recurrence of vaginal yeast infection, and then you're wondering what is coming forward, what's happening and all, now that could be the one responsible for it. And another thing, adverse effects common to those on dapagliflozin is weight loss. Actually, yes, weight loss. And dehydration too. All right. Okay, so I'm trying to watch my time too, and at the same time trying to give teachers information. Another class is what we call the thiazonidine. That's example is pioglitazone, and that one actually they help to increase insulin sensitivity. I mean, they help your cells to be sensitive to the insulin that is being produced. In other words, they help your cells to make use of this insulin. So, example is that pioglitazone. But there's something about this. It's the adverse effect is related to heart failure. So it's strictly monitored. I mean, it's strictly monitored, unlike how others, but it's strictly and basically monitored. So your doctor, when he's prescribing it, he has accessed you, he has checked, and he has seen, okay. So it's strictly and basically monitored. All right. And other classes, let me just mention the other classes, and then we have what we call alpha glucosidase inhibitors. Alpha glucosidase inhibitor example is acarbose and miglitol. Now this one is you know the bigger glucose is oligosaccharides. When oligosaccharides is broken down, it's broken down into glucose. When you take your rice, it's not glucose, so to say like that. It's a oligosaccharides. You know, so but it's been broken down into glucose, and the enzyme responsible for that breakdown is what we call alpha glucosidase. So when that enzyme is at work, it breaks down that oligosaccharides. I mean, the food you eat in form, because they are in the form of in the body as oligosaccharides. The food you eat, they're in the body as oligosaccharides. So it breaks it down into glucose. Alpha glucosidase is responsible for that. So when you inhibit that particular enzyme, it stops that breakdown, it stops that process. So in other words, it will now reduce the sugar, the glucose level in the bloodstream. So that's just basically how it works, and that's all these agapos and biglitol. And what should you watch out for concerning this particular drug? Anyway, it also causes GI upset. It upsets your gastrointestinal tract, and then it also brings about bloating. You can just begin to bloat and stuff like that. All right. So, what are the do's and don'ts when it comes to you? If you're on anti-diabetic drugs, what are the do's and then what are the don'ts? Number one thing I need to say is that the do's, please, please, do not self-medicate. I repeat, do not self-medicate. Self-medication is not it's not a thing for you to do. Do not self-medicate. I mean, it's important for you to be appropriately diagnosed. I've seen situations whereby people just begin to take drugs, even when they are not being prescribed, probably because of accident in some countries now where you just have free access to some drugs. And but please, it's not advisable for you to self-medicate. You need to be appropriately diagnosed. I repeat that again. Do not self-medicate. You need to be appropriately diagnosed. You need to know. Let your healthcare provider assess you and diagnose you and be able to identify that okay, this is it and this is that, and then be able to also prescribe the medication that is suits for you. So do not self-medicate. And then another thing too is about the misuse of your drugs. Do not misuse your drugs in the sense that don't overdose. I mean, follow the required, take the required dose given to you, prescribed to you. Do not overdose, and then don't also underdose. If you miss your dose, if you miss your drug, maybe probably you needed to take the drug and then you miss it. Just take it the moment you remember, and then don't go and take more than because you want to cover up for the time that you miss. No, 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 no. Let's not do that. Do not um overdose. Do not overdose. And then what are now the things that you should what are the okay, yes, do not self-medicate, do not misuse your drugs, overdose or do. And another thing that you should do now in terms of that your when you're on anti-diabetes is you need to regularly monitor your blood sugar. It's actually very important. You need to regularly monitor your blood sugar. Like I said, like this all these oral anti-diabetes, they have the potential to cause hypoglycemia. They have that potential, and the goal of management, the goal of this medication is to bring your sugar level to the normal physiological range. I mean, it's not to reduce it to maybe below the required one by the body, but it's to bring it to the normal physiological range. So you need to regularly monitor your blood sugar. You need to regularly monitor your blood sugar. And then, like I said, it causes hypoglycemia, most oral anti-diabetes. So you can also watch out for signs of hypoglycemia. Like, I mean, when you begin to experience, it's just opposite the symptoms of hyperglycemia, as mentioned by Dr. Ogutoye. That was a very good session. As mentioned by Dr. Ogutoye, I mean, the opposite. She talked about what is it called, excessive what is it called now, tests, test polydipsia and all of that. But in terms of hypoglycemia now, one of the symptoms is excessive hunger. Excessive hunger, and then you begin sweating, shakiness, faint. You need to watch out for those symptoms. When you begin to see that you are having that tendency, and then you are seeing some symptom, it's good for you to have something like maybe a coke or cubes of sugar beside you, so that you can always stay to restore that because that's symptoms of hypoglycemia. So you need to watch out for that. You need to watch out for that. And then another thing is please and please follow your prescription and take your drugs religiously. Follow your prescription and then take your drugs religiously. Take it as instructed. Take it as they have told you to take it. And then if there is any, because I know there is also likelihood, because I've seen that most especially for patients that are elderly, and then there is that possibility maybe you cannot recall how you have been told to take your drugs, how it has been prescribed and stuff. Please, you can always walk up to a healthcare provider around you, healthcare professional around you to put you through, to guide you. You can walk up to the pharmacy and ask what to see the pharmacist, and then you can, okay, you cannot recall all this and this. Please, can you push me through? How should I take this? And then especially for patients with on insulin. Now, it's important for me to also mention that insulin therapy is also being used in type 2 diabetes now, because in the process whereby the oral medications and lifestyle modifications, all of those things are not working. I mean, they are not. When I mean they are not working, is that they're not bringing the blood sugar level to the required range that we want. That's probably the healthcare provider want. So insulin therapy can also be used in that particular situation. So it can be used in that particular situation, and it's insulin, because like I said, it's important depending on the type of insulin that you are giving. If it's the rapid onset, it can bring about hypoglycemia so fast without even, it can crash that sugar level so far. So it's important for you to know the appropriate dose and how to also use it. So you can always ask your healthcare provider around you, please, can you put me through? Can you help me? How do I make use of this? So it's important. Don't just assume. It's not good to assume when it comes to diabetes management. It's not good to don't assume that this is the dose of your drug. This is how it should be. You don't assume. please seek clarifications from your healthcare provider. I think let me stop here because of my time. Thank you so much, and let me hand over now to Nurse Damin Larry. Thank you so much for having me. I'm still around for in case of any questions relating to your drugs and your medications, and maybe you have any question concerning none of it or clarifications. So I'm still around. Thank you so much.
Yes, thank you so much, pharmacist at ABC Igagbo, and thank you for doing justice to that. A whole lot has been shared. Yes, I know someone is wondering what are these big names. Well, if you are currently being managed for diabetes, you have an idea of what those drugs are already. You are probably taking one of those drugs if you are not currently on lifestyle modification. So, if you are taking any of these drugs, yes, you just need to pay attention to some of the things that the pharmacists have shared. And if you've got questions, if you've got things you want to clarify, you can drop it in the comment section and we will just help you to bring it up later on. All right. So right now, I'm going to be bringing up the dietitian to educate us. This is one part I am really looking forward to because we I get a lot of questions from people. What should I eat? What should I not eat? And it's really a question bothering a lot of people. Whether you are having diabetes currently or you are not having it, there there is something you need to learn from this section. And if you are currently joining us, you could please share this live stream with people, share it, share it with your friends, share it with somebody who, whether they are living with diabetes or not, share it with them. The idea is that you learn what not to do so that you don't develop diabetes. All right. That's what we're trying to. So we're covering every ground. If you've got diabetes, you're welcome. We want to provide the needed education and support. If you've not got diabetes yet, you want to know what to do to prevent it. All right. And right from Dr. Timmy down to pharmacist Adevisi, now we're going to um, a dietitian Bolanle Dada. She was here last year with me. We had it on Twitter Space. It was amazing. Very resourceful um, section she had with us last time. So yes, welcome,
Hello,
welcome.
I'm
Hello.
Damian.
Thank you very much for accepting to do this with me again.
Yes,
All right,
thank
so I'm just
you.
going to put you on the spotlight and then you can go on. Thank you very much.
Yes, thank you. Thank you for having me. Hi, guys. Yeah, my name is Bolanle Dada. I'm a registered dietitian and nutritional professional, and I'm very passionate when it comes to health, when it comes to improving nutrition. Yeah, let's just get into it. So, yeah, and I would say thank you, the Nurse Damilare, for this opportunity, to speak again. Last year was wonderful. It was awesome, and I'm glad to be part of this once again. Okay, so the issue of diabetes is something that it's fast growing at a very alarming rate. Imagine every 21 seconds someone is diagnosed of diabetes, like worldwide. And that means even within the period of our discussion today, several lives are being impacted by this, you know, complex disease, but then it's preventable. Just that we don't have a cure yet, but then it is actually very preventable. So when it comes to preventing diabetes, because that is what I would basically be talking about, preventing diabetes and also managing diabetes when it is not established that you actually have diabetes. When it comes to preventing diabetes for especially for young people and for everyone. Preventing diabetes, especially with diet, because I'll be majoring on diet and lifestyle because they are intertwined. They are really connected, and even because that it's something we do daily. It has to do with our daily choices when it comes to our diet and the way we live our lives. Um, so, talking about high blood sugar in itself, like Dr. Oguntoye has mentioned, it has to do with insulin, and we've been hearing insulin a lot. So, insulin is actually the hormone that regulates blood sugar. And when it comes to diabetes now, it means that there is insufficient insulin production. I'm talking about type 2 diabetes now, which we are focusing on because we now know that we have other types, but we're talking about type 2, which is the modifiable one. Insulin resistance is when the body cells are, like resisting the action of insulin to take in glucose that they need for their energy. And that's why even weakness is one of the symptoms of diabetes. So, how do we prevent diabetes? So I'll just touch on the risk factors that are related to diet and lifestyle, which includes obesity. Obesity is a risk factor in the sense that, there's excessive weight gain, maybe due to PCOS, as she has said, maybe due to hypothyroidism or some other hormonal imbalance. And how it happens is that, you know the the body is usually resistant when there is obesity, when there is occurrence of obesity. And obesity is actually excessive weight for age. And not only is obesity the real issue here, because to understand obesity, like, there is excessive weight, right? When you check your BMI. But the thing is even that, the fat distribution in the body now is equally important. Is equally as important, because someone can even be thin and be I mean, having fat distributed in an inappropriate way. That is when there is visceral fat, and that has to do with what we call this pot belly or fatty tummy, because in as much as you need some level of fat to cover your organs, to cushion the effect, to provide insulation for your body and warmth for your body, it is also important that you don't want to have excessive abdominal fat or visceral fat, because this can even increase insulin resistance. Another thing is unhealthy diets, not making the right diet choices, which I'm also going to talk about shortly, and poor lifestyle choices like smoking and sedentary lifestyle. You sit on a spot for so long. We're going to talk about that. So these are actually risk factors that I want us to, like, take note of. Another thing is high blood pressure. So when there is um, elevated high blood pressure or hypertension over a period of time, and it is not being monitored, it can also predispose one to um, 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 diabetes. And all these are diet related, like I've stated. Okay, so how do we prevent this? Healthy eating. And healthy eating, in the sense that, is the goal now is not even just to prevent diabetes, but even to prevent other common diseases that we know of, be it hypertension, talk of cardiovascular diseases, talk of GIT issues and things like that. So healthy eating is actually the key to even preventing diabetes in itself. So for healthy eating for diabetes, I will just focus on some nutrients or some key areas in the diet that needs to really be taken care of. The first is fiber. Yeah. So I don't know if we've really heard about fiber. Fiber are important. Fiber. So what is the big thing about fiber? Fiber is actually very important for overall health. Talk about weight management, talk about, because So many people mix things up when it comes to, okay, oh, I'm overweight, I want to reduce my weight. They are not taking into account how what they consume. So talking about fiber, you need to consume fruits that are actually high in it. Usually the recommended RDA for fiber is about 20 to 35 grams per kilogram per day. So like I mean gram per day. So you need to consume, and the sources for fiber are vegetables, fruits, your legumes like beans, like your cowpea, your whole grains. So that means you are trying to like reduce your consumption of processed foods, because processed foods are low in fiber, right? Do you see now? They are really low in fiber. So you want to consume more of whole grains, of unprocessed foods. All right. So another nutrient of importance that I want to talk about is cholesterol. So there's this big buzz about cholesterol. Doing this, it is low in cholesterol. I get many questions about cholesterol, and cholesterol is actually needed by the body, right? But the issue now is when it is, well, is the type of cholesterol, or the type of we call them lipoprotein. So we have two major types. We have the high density lipoprotein. We call them the good ones. Those are the good ones. And we have the low density ones, which are the bad cholesterol. So you want to lower the bad cholesterol that you consume. And which sources, what are the sources of bad cholesterol? We have you know eating, when you want to eat your poultry, your chicken or your turkey, the skin covering the skin of the chicken is actually high in the bad protein, that's the LDL. So you want to remove the skin of your chicken before you eat them. And you want to avoid frying too, because okay, when we now talk about LDL, I would like to classify it into saturated fats and trans fats. So the saturated fats sources are, just like I've mentioned, the chicken skin, fried foods, baked foods, overly processed foods with added salt, they are actually high in saturated fats. So you want to avoid them to the barest minimum. And also trans fats, also from fried foods, reusing cooking oils. Those practices are not healthy. I understand that even for most people in Nigeria, right now, things are costly, so you want to keep reusing oil, or you want to manage all of that. You should take note that this might be harmful for your health. So in prevention of diabetes, these things need to really be considered. And all this being said, that means even in your when you purchase items now, you want to begin to look and take cognizance of your of the label on the commodity you're buying. Let's say you're buying a juice, or anything you're buying. You should check out for these things: saturated fat. You look if it has, some will tell you, oh, there's no trans fat. Some will tell you there's no saturated fat. Some will tell you, oh, this is the percentage gram, and you can know how many gram of the saturated fat per 100 gram of that commodity, right? So really looking at nutrition labels is really, really important. Another nutrient of importance that I want to talk about is protein. Okay, so about protein, the thing about protein with diabetes is I just want to break a myth about protein, because when it comes to obesity, and when somebody is obese, you want to do weight management, weight loss, and all those things. And you see people tend to follow different trends of dieting, like the ketogenic diet, keto. So the thing about keto is that in its own, it's a good diet, but it has its purpose. It's used for different purposes clinically, like in cases of epilepsy and things like that. But for weight loss, it is not a sustainable way of losing weight. I keep telling people that, because what happens is that, or let me just explain for those that don't know what keto diet is actually, is consuming large portion of proteins and maybe just little percentage for carbohydrates, and then there is fat in the diet. But basically, consumption of high protein. The implication of this is that it stresses the kidney, because the kidney is the organ that processes the waste from this protein and all of that. And again, there's no protein sparing action. So that means that, because the body actually needs sugar, the body cells, they need glucose to function, just like I've mentioned. For energy, the brain needs glucose, every body cells needs it. So the body automatically would manufacture glucose from what is available. So, and in this case, for people on keto diets, it is protein. So that means protein would be processed. We undergo some process to deliver glucose, and in the long term, this leads to ketoacidosis, and it can lead to other health conditions, right? And we want to avoid that. So overload of protein is bad. Moderation is key. And when it comes to restricting protein, is when there is like early stage of kidney diseases and things like that. So protein is something I want us to really take cognizance of. Moderation is key, and following a balanced diet and adequate diet is also key. So to know your balanced diet, your adequate diet rather, because there are two different things. So balanced diet is a diet that consists of different classes of food, the six classes of food: your protein, your carbohydrates, your fats, your minerals, your vitamins, and of course water. But when it comes to adequate diet, it's talking about a diet that contains all these nutrients in required amount, personalized for you. So a way to know your protein requirements is to talk to a dietitian, if you just want to have an idea. But basically, for protein requirements, it's usually, I think, around 0.8 to 1.2 per kilogram body weight. That's about 60 to 72 grams of protein per day, which we can now convert, for different food products like your meats, your beans, just to make sure you meet up. Anything overload, like in case of ketogenic diet, is a no-no. You shouldn't be done that way. Okay, the very important nutrients that we'll be talking about lastly, like the last but not the least, is carbohydrates. Because when it comes to diabetes or blood sugar, hyperglycemia, people lay emphasis on carbohydrates. They tell you, just like for keto, oh, just eat proteinous foods. Don't eat, in fact, don't eat, eliminate carbohydrates totally from your diet. This is not true. Even for weight loss, everything should be in proportion. You need all your nutrients, you need all the six classes of nutrients across different food groups to function, right, as a healthy human being. So for carbohydrates, focus on um, complex carbohydrates and not simple carbohydrates. So what are complex carbohydrates? Complex carbohydrates are actually um, food sources that are, like, they are starchy, and the idea is that the rate at which they release, because the end product of carbohydrates is glucose. So the rate at which they release glucose into the bloodstream is actually slower than the simple sugars that, like, quickly they just release glucose into the bloodstream. So you want to examples of complex carbohydrate that you should consume is your whole grains, like I mentioned before, your whole legumes, natural, your not your fruits, right? Even though, yeah, some most fruits, the sugar present in foods is fructose, but you can consume fruits. Yeah, you need the vitamins, minerals from fruits. So when it comes to carbohydrates, you want to make healthy choices like that. Your tubers, and more natural foods like that. um Simple sugars should be avoided because, of course, when you take them, there's this thing about taking simple sugars. Once you start taking your simple sugars, your brain tells you, oh, I want more, I want more. So you consume more than you should. And what happens is that the pancreas is stressed because the pancreas is that organ in your body that produces insulin to regulate blood sugar. So the pancreas becomes overworked, and that can lead to insulin resistance, just like we've said earlier. So go for more complex sugars. Avoid simple sugars as possible, as much as possible. I know I mean, so many of us have what we call the sweet tooth, but it's doable. Just like I said, going for fruits, you can make your fruit juice, instead of taking carbonated drinks. Okay, carbonated drinks is another thing that I know so many people struggle with, and they are majorly loaded with lots and loads of simple sugars. So you want to do away with them. So an alternative you can use is actually making your juices, your smoothies, just to substitute, having an healthy substitute. You could use infused water as well. You can make that by slicing some fruits into your water, just to boost um the satiety of the water. So also taking water is key. You need to take about 3 liters, 3 to 4 liters per day, 6 to 8 glasses per day to aid your metabolism. Um, One thing I want to talk about is breastfeeding. As a breastfeeding advocate, I know the impact of breastfeeding. Okay, so breastfeeding is important. How it is related to diabetes is in the fact that breastfeeding actually helps um, mothers, nursing mothers, to gain to return back to their pregnancy weight. This is because most women tend to gain weight during pregnancy, and even postpartum. They keep experiencing the gain of weight, but breastfeeding can help return back to their weight before pregnancy, and that would mean reducing chances of obesity, overweight, and in the long run reducing the risk for diabetes. So that is it about breastfeeding. And yeah, even for the baby as well, it is also beneficial. So a baby that is well breastfed, particularly following exclusive breastfeeding as recommended by WHO, that kind of baby would have, an overall health. The GIT will be strengthened, will develop well, will be well matured, and there will be reduced risk for GIT issues or metabolic issues like insulin resistance and diabetes. So breastfeeding is actually very, very important in preventing diabetes. Now let's go to the second part on diabetes management. So you have diabetes. How do you go about it? So the goal for diabetes management is, as the previous speakers have said, is to reduce or regulate the blood sugar to the normal and required level. And also, another important thing is to reduce cholesterol, because they work hand in hand, right? Because high level of the bad cholesterol, like I explained, can lead to more insulin resistance and some hormonal balance, including insulin imbalance. So, um, preventing complications of diabetes is really essential. So, you want to reduce or regulate the blood sugar level. You want to reduce the cholesterol or maintain a normal cholesterol level, as well as reduce occurrences of hypertension or increased blood level. So those things are taken into account when managing diabetes. And like we've heard, three key ways. One of the major ways is the drug, as explained by our pharmacist. Major ways of using whether the insulin or the hypoglycemic drugs to reduce the blood sugar. Another way to manage, or an effective and more sustainable way to manage diabetes is diet. Then the third way is your lifestyle and exercise. So all of these, they don't work independently. They can't like work in isolation. You have to take into account the three of them together: your diet, your medications, whether drug or insulin shots, and then exercise. And we might have questions like, oh, will I have to be on drugs for the rest of my life? Because it's a lifetime thing. It's not curable. You just have to manage it. Well, the good news is that you could actually stay off medications after a while if you're doing it right, especially with your diet, because of course that is a daily choice you would have to make, like I said. So when you work with your healthcare providers, following your drugs, as at you take your drugs as at when due, you follow your doses, your prescription. It's also important to speak to a dietitian, so that you could be well monitored when it comes to your food choices and intake, to consider your preferences. Like I tell people, diets and dietary interventions is a personalized thing. It's not a black and white thing, or like a one cap fits all kind of thing. So you have to work with these professionals to tailor your kind of treatment. But I will just talk generally about diet management when it comes to diabetes. For your diet now, the time you eat, the kind of food you eat, how you eat them is really important. The time you eat now, you want to eat early enough. You don't want to skip meals. And this also, um sorry, I forgot to mention, even when it comes to the preventive part of the discussion, you need to eat at ideal meal times. Like you eat your breakfast uh, very early, like 8, 9. It's called breakfast for a reason. So you've been fasting from the last night and you're breaking your fast. So you have to eat early. Some people eat breakfast late as 11 o'clock in the morning, 12 o'clock in the morning. This is not healthy. You can just grab something in the morning. I mean, if you're not fasting, if you're not performing a spiritual exercise like fasting, you need to eat your breakfast very early. Then your lunch time should come around 1 to 2 p.m. Max like 3 p.m. So you don't want to skip any of these meals because they are all important, right? Um, then your dinner too should be around 6 to 7. And I'm putting timestamps to this, particularly for people with diabetes, because it is actually important. But for even for everybody, you shouldn't eat your um dinner very late. It is not good. It is not a good practice because it has implications for obesity. It has implications for fat distribution, like I explained. You know, when even when you want to reduce, for women that want flat tummy, it is not advisable that you eat late at night. So eating late at night should be avoided, especially for people with diabetes. um when it comes to carbohydrates now, so because carbohydrates are actually the nutrients that is being put on the spotlight. They produce glucose. They give off glucose in the end, and there are a lot of myths about it that, oh, just eliminate carbohydrates and just eat beans. And even beans, the thing is, even beans has some carbohydrates, right? But people now like um keep eating beans, keep eating beans, and that would be protein overload. And like I explained, you want to avoid that so that you don't cause some implications like renal, like kidney problems, that is even associated with diabetes, which is one of like the implications we are trying to um mitigate against. So you want to avoid that. So for carbohydrates, it's essential that you follow portion control. The portion control is key. You can use the plate method, or calorie counting. And this calorie counting, you have to do it with your dietitian. It's not something you need a professional to do it for you. He or she would consider a lot of things to place you on that certain calorie, especially when you're on drugs, like these drugs, this metformin and glucophage, all those drugs. I mean, if you don't eat enough as you should, it can make you weak. You can go hypo, and that is very, very dangerous. So you have to work with a dietitian so that you can keep monitoring these things, and with time you would know how to, I mean, manage your diet, right? Like I said, for carbohydrates, no simple sugars. Go for complex sugars more. The only time when simple sugars are used for the diabetic is when maybe there's hypo hypoglycemia, that is the blood sugar is low. So the person has to be giving coke so as to balance. The key goal here is to get a balance. So but complex sugars should be used, should be consumed. Now, the type of carbohydrates is not even as important as the quantity that is being consumed, because somebody can be consuming complex carbohydrates, like you're taking oats. You're taking oats because oats is high in fiber. Yeah, that's good. But then the quantity, if you're not, if you're taking it in excess, for example, now, the end products, the sugar it will produce will be higher compared to when you take um the adequate quantity for you. So portion control is actually key. The quantity you take is actually key. Yes, the type of the choice you make is important, but then the quantity is key. Also, the the kinds of foods that you eat with your carbohydrates is also important, right? You want to take foods that are high in fiber with your carbohydrates. Like I recommend to patients that you take vegetables like cucumber, like your garden egg. What it does is to like mop out the sugar in the blood, so it keeps it regulated. So essentially, take vegetables, take foods rich in fiber. And for consuming fruits, you need to like monitor it, because now that there is diabetes, fruits actually have sugar in them. So you want to minimize your fruit intake to about one per day, one kind of fruit per day. Like say one orange, one apple, um, like that. So two fingers of banana, and yeah, like that. So the key point here is the type of carbohydrate you take is important. The quantity you take is important. Portion control is key. Moderation is key. Then the form of the food too is also important. For example, when you fry things. So I even forgot to mention, you avoid frying things. You can use an air fryer. There are more healthier ways to do all these things. You can use an air fryer instead of deep frying in oil, to reduce fat and trans fat and all those things that we discussed earlier. So I will leave it at this. If you have any questions, you can drop them in the comment section, and I will be happy to answer them. Thank you very much.
Thank you so much. Thank you so much. It's always a lot to give within the short time. I understand that very well because diet is something that everybody have one question or the other to talk about. I don't know if you can just answer this question right away. So you might just want to turn on your camera. So someone is asking quickly, do you do, it's on the screen, so do you do personal consultations? I think you do have a platform for that. You can just put that out quickly.
Yeah, so thank you so much for the question. I actually do personal consultations. Yeah, I do them online, right? You can reach me via Instagram DM at dot_dexa, or you could just search for Bolanli Dada via all social media platforms like LinkedIn, like Instagram, Facebook, and we take it up from there. So
Oh,
yes, I do
yeah.
consultations.
There's
Thank you.
one more question. Thank you. How much protein on average does the body need per day? I think you mentioned it. Can you?
Yes. So around 60 to 72 grams, because 0.2 0.8 to 1.2 gram per kilogram body weight is needed. So it is assumed that an average human being or an average adult weighs about 60 kg. So when you do that calculation, so it falls in between 60 to 72 grams for a day. So anything beyond that might be too much.
Okay. 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 So I was going to just ask if that could be practically said. I mean, do I carry my beans and or what is the protein and put it on the weighing scale? Or how do you do that analysis?
Yeah, actually, the way to do that is actually to convert. It might be hard. So we have this food composition tables. The food composition table where you do the household um, exchange, like
Okay.
in one. It's a mathematical thing. Like in one, let's say in 100 grams of beans, how many gram of protein? Because in that beans, it is not just protein that is there. You
Mm,
have good fats, you have carbohydrates. Like I said,
mm,
so many people are surprised to learn that, because even me, I've always learned that in beans, I mean, it's just protein, it's a proteinous food. But then we have
mm.
carbohydrates, so it's just a fraction of the protein that is present in the beans. So it's just calculating to make sure that it now meets up to the 60 to 70 gram per day. Yeah,
Okay, so definitely anyone who needs to know more, we need to see a dietitian directly. All
exactly.
right, thank you so much. So that we are able to keep up with time, we're just going to set up for the last section. And I believe Mr. Isaac, who asked that question, has gotten responses. please just put a note on the in the comment section so that we know you have been properly answered and we got the response. Okay. All right. So in the next 1 minute, we're going to go into the last section. And if you've got any questions while watching this live, you can drop it in the comment section. We've got a lot of people on YouTube and on Facebook watching us live. You can just drop your comments in the comment section. All right, and then if you have questions too, drop it there, and we'll pick it up from there. A lot of things have been said. You can always go back to watch this live section again and again, and I trust that it will help you. So very soon we're going to. I want us to watch this briefly, and we will be. All right, welcome back, and I trust you have learned something. That's just a little of all of that have been compiled to just help you distill all of the things we've been hearing. You must have seen some of those things in key points, what you should eat, how you should do with your drugs, some bits of information on diabetes generally. So this last section is going to be about mental health. Um, in the last time we had this section, or the last World Diabetes Day, we did not have this section because I had not seen a need at that time. But after a while, relating with people with diabetes, I began to realize that there are lots of people who are actually living with diabetes and are experiencing a lot of mental health issues. a lot of mental health issues, and that's why I said let's bring someone up to help us through talking on these issues of concern. There is diabetes stress, there is anxiety, there is depression, there is a lot of issues with behavioral modification, people who are addicted to tobacco, people who are addicted to alcohol, and they're finding it difficult to get away with this. These are mental health issues, and we will be having a mental health professional to just throw in some light into this. And if you're watching this, you will greatly benefit from listening and even telling others about this. All right. So very soon we'll be having our come up. However, we can just take a quick show. Okay. All right. Thank you very much, Kenny, for joining us. Are you
Yeah,
okay?
yeah, I'm fine. Sorry,
Good.
there was interaction in the network.
That's okay. That's okay. So let's get started. We're going to get started right about now. All right. Welcome back. Okay, let's get started right away. Welcome. We believe that you have so much to share with us already, and we hope that you will be able to communicate everything with us within the remaining time we have. All right. Thank you very much.
All right, good evening. My name is Adelano. Thank you, Nosdi, for giving me the opportunity to be here. So I'll be talking about behavior or lifestyle that put people at risk of diabetes, and also I'll be talking about mental health issues that people with diabetes face. So I'll start with the behavior that put people at risk. There are a lot of behaviors that actually predispose people to risk of having diabetes, but then I would narrow it down to three main headings, and the reason is because these particular causes are causes that are overlooked by people. They don't see it as a problem, they don't see it as an issue to their health. They see it as day-to-day lifestyle that they are used to, that they can't do without, and all of that. So the first thing I'll be talking about is tobacco use. Smoking, people see smoking as just normal thing. You just go on the street, you see them smoking. Some people can smoke 20 sticks a day, and they don't see it as a problem. Meanwhile, there are some chemicals in these things that they smoke that actually damage the cell. So it interrupts the cell from identifying or making use of insulin that is being produced, the little insulin being produced by the body. So the cell will not be able to make use of it, thereby the blood sugar level will just spike up, and the body might not be able to manage it. And then some of these chemicals to also cause inflammation of the cell. And when the cell is inflamed, there is no way it's going to be able to work actively. It's just like a damaged cell. So there is nothing the cell can do. Then also it can stop the cell totally from responding to insulin. Then smoking actually predispose people to having belly fat. When we talk about belly fat, like the dietitian said earlier, that belly fat is a risk factor to developing type 2 diabetes. Yes, it is a risk factor. And the funny thing is about it is that the person with belly fat might be very slim in physical. When you see the person does not look like someone that actually have um fat at all, because the person might be slim, but then there is internal belly fat and is already predisposing this person to type 2 diabetic. So for smokers, they have like 30 to 40% of developing type 2 diabetes more than those people that does not smoke. So what I'm trying to say in essence is that the higher the rate of smoking, the higher the risk. So the second thing I would like to talk about is alcohol use. Yeah, there are some life circumstances that we face at times that is just overweighing. It's just weighs you down and you feel like, why is this happening to me? Maybe someone lost a loved one, or lost a job, or failure in academics and all of that, or failed relationship. And people think the best way to actually deal with that is to, you know, resort to taking alcohol or tobacco. That this is how it calms them, this is how it works, it calms them down. They don't remember the situation facing them, they don't remember what is going on around them. All what they see is that, ah, yes, I'm in this, other realm, I'm in another realm entirely, so I don't remember my problem. And they forget that alcohol, tobacco, it's work for a period of time, it wears off. So this make them keep going back to, taking more alcohol, taking more tobacco, just to get that effect, to escape that life situation. Meanwhile, once the effect wears out, they are coming back to face that situation. I think people does not really think about that when the effect wears out, they are coming back to still face that situation. The taking alcohol, taking tobacco does not really change the situation. It does not have any effect on the situation. It's just keep piling up and cause damage to their health. I think people neglect that part, or maybe they don't pay much attention to it. So my advice is that if you are not an alcoholic, like you don't take alcohol, it's better you don't start, because when you start taking alcohol, you just keep going. It starts from a trial. Let me just test it. Let me just see how it tastes. Let me see how it makes people feel. That's how it starts, and then gradually, the person becomes an addict. It's very very important that if you are not an alcoholic person, you don't start and become an addict, because when you become an addict, there's a psychological aspect to drug use like alcohol and tobacco. So for those people that are already addicted, some people might not even know that they're addicted. That's another thing. But for those people that know that they're addicted, it's good to actually seek help at an early stage. Like Dr. Timmy said, early diagnosis actually aids early treatment. And when there is early treatment, the prognosis will be very good. But then if you are covering it up that, no, I don't want them to see me going into a I don't want to call it a psychiatry room now. I don't want people seeing me going to a psychiatry hospital. Let me just use it that way. To go and say I want to see a psychologist, I want to see a psychiatrist, and all of that. If you sit down and put into consideration the help you will get, if you sit down and think through that, okay, I'm going to get a basic breakthrough in my health, because alcohol does not just lead to diabetes and mental illness. No, there are some other medical conditions that alcohol can be a major risk factor for. So with getting early help is going to actually prevent that. So it's good to seek help early. I know that it can be stigmatizing that, oh, I want to go and see a psychologist or something to just help me stop taking alcohol. People will tag me as a mad person and all of that. Yes. But people that tag you as a mad person is because they don't have the knowledge, they don't have the understanding, they don't have the awareness. They have this misconception in their head that, okay, anybody that walks into a psychiatric home, the person is actually going there. No, 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 no. That's not how it is. But then you know the importance of doing that. So it's left to you to decide. So there is something called smoke pack here. This smoke pack here is just a way of calculating the amount of cigarettes that an individual takes in a day for 365 days, and that's a year. That's what smoke pack here is talking about. So there is a grading level. It's just a diversion. I'm just trying to explain that there's a grading level to that. People that take 0 pack of alcohol in a year, they are not smokers. But people that take 1 to 20 packs a year, they are light smoker. The people that take from 1 to 40 packs a year, they are moderate smoker. But anybody that takes above that 40 packs a year, that person is a heavy smoker. So, and the person is already an addict safe. So I would like to talk about some signs that you see, because some people might not know that they're an addict already. They might just think of it as, the normal way of life, normal routine. When I wake up in the morning, I do this, I do this. That's how they see it. But then they're already an addict. They can't do without it. The first sign is that when the person cannot do anything without taking alcohol or tobacco, that means the person is already an addict. The person cannot function well without it, that means the person is an addict. And or the person cannot stop at one. Maybe the person takes one wrap and just keep going, going, going. The person is already an addict. Then having this uncontrollable urge that I want to take this thing, I really want to take this thing. You can go all out, you can do anything just to get it. You can do anything to get this alcohol or this tobacco. You can go any length. The person is already an addict. Then as time goes on, there's something called body tolerance. Your body begins to, tolerate the amount of alcohol you take or the amount of tobacco. So you need to increase the dosage to be able to get the same effects you've been getting in the past. So that means that someone that is taking 1 bottle of alcohol, we start taking like 2, 3, 4 bottles. Someone taking 4 bottles before, we increase it to 8 bottles and all of that, just to get the same effect that they have over time. Then also the person might start having problem at work, maybe getting angry at slight provocation, or inability to just cope with people around, inability to manage themselves. When someone is craving for something and the person does not get it, how that can be, how that can get. Then for some people that are in school, they might not be able to, function properly with their academics, and then there's this loss of motivation. I don't want to do anything. I just want to get my alcohol. I just want to get tobacco and just feel all right. And so at some point, people start some people start at some extreme point, people start neglecting their personal hygiene. They don't take care of themselves, they don't bathe, they don't brush, they just take their drugs and just, sorry, we generally call alcohol, tobacco, everything drugs. That's what we call it in our facility. So sorry, you might hear me mentioning drugs. I'm still talking about alcohol and tobacco, and there are some other drugs, but this is the focus for today. Then the last thing I'll talk about is excessive spending. This person can sell their properties just to get alcohol or just to get tobacco. If they don't have money, they can sell anything. They can sell their phone, they can anything valuable to them. They can sell it just to be able to get that alcohol. So addiction is not, I would not call it a disease, it's a disorder actually, and it can be managed. And the earlier you seek for help, the better it gets. And then seeking for help at the appropriate place is very important, because if you talk to some people, open up to some people, the advice they will give you might not really be something worthy to be followed. So you need to look for the appropriate place to get help, so that you can be, treated. And there are a lot of treatments planned for people with addictions. Like there's something called alcohol anonymous group. This is where people that are already addicted, they come together and they share their experience, what alcohol has or other drugs has made them do in the past, what they have done in the past just under the influence of the alcohol, and how they're able to get their freedom and all of that. So that's one. Then there's the behavioral modification treatment. It's a therapy, and it's like a talk therapy, psychotherapy, like counseling. So it helps the drinker or the addict to be able to curb the way they take these things, to be able to minimize it and cut it down to the lowest. So it's like a continuous counseling, continuous talk, continuous psychotherapy. Then medication is used too at some stage. Medication is combined to treat it. I think our pharmacist has spoken a whole lot about that, so I won't be going back to that. So the third thing I'll be talking about here is excessive stress. Actually, excessive stress, this stress, normal day-to-day life, we face stress. Yes, we are we are always facing stress, especially those people living in Lagos. I actually give it up to them. Like, I give it up for them. They are really, really trying, leaving their house in the morning. They have to make it to work by maybe 7, 8 in the morning. They have to leave their house as early as 4. Some people as early as 3. They will leave their house. They have to wake up and go. And while leaving their house, they are going to go and sit inside traffic for only God knows how long. They will get to work. They will work. After working, they will now go back home again to go and do some other things. They are going to work tomorrow again. They have to wake up as early as maybe 2 or 3 to get prepared for work and all of that. So that level of stress. And when there is continuous stress, stress will be produced in the body. And this stress hormone is going to trigger um, increase in blood sugar level. So I to be able to manage our time, I would like to go to the next one. The mental health illness that people living with diabetes has to watch out for. Yeah, diabetes can, it can be life altering when someone just wake up one day, go to the hospital and got treated, and they're like, oh, we're sorry, but we need to inform you that you have type 2 diabetes. It can be so alarming. It can be so stressful, because the thought of it at first will be like, so what will happen like this? I'm going to have to change this about myself. I'm going to have to do this. I'm going to have to do that. So that thought is very, very stressful for them. So I will talk more about this stress under I did talk more about the stress under the people without diabetes and people with risk of developing diabetes. So I'll talk more about it here. So for people with diabetes now, when they are told that, oh, you have diabetes, like I said earlier, some of them, the way we react to situation or circumstances differ. Some people at that point, they might they might almost develop high blood pressure. That, God, what was happening? I left my house to come and get treated here, or to come and just complain and go to my house and all of that, but see what I'm facing and all of that. So, and they have to combine this with other life situation, like their relationship with friends and family. They have to combine all of this together. It can be so stressful for them. They have to combine their life, their normal day-to-day life, like going to work and all of that. So then getting to know that they have diabetes, they have to check their blood sugar, they have to get insulin when need be and all of that. So it can be really, really stressful on them. And then they have to now establish a new routine, like they have to change their diet plan. Some of them have to be on medication. For those that will be on medication, they have to be on medication and monitoring the blood glucose and all of that. So it can be really stressful on them. And there is something about detecting this mental illness that people with diabetes face, because at times they might see it as their reaction to the diagnosis that is just made. They are just hearing a new diagnosis, maybe that's why they are feeling that way. So most of them slip into depression without them knowing that they're actually going into depression. Most of them just go into depression because there is actually something called diabetes stress. I will talk more on that later. So, but then most people, they don't get treated because they don't see it as a mental health illness. I believe that even if we are not talking about diabetes, any condition, any disease condition that someone is diagnosed of can be really, really stressful, can be really, really heartbroken breaking, can be, you know this life event can be it can be like a hard blow to them. So I believe that they need to see a psychologist, they need to see a psychiatrist, they need to talk to them, just to be sure. For those that are yet to develop depression, maybe they can actually prevent it at that level. But I just believe that even if it's not diabetes, any other condition, any other disease, once someone is diagnosed, the person should be referred to a psychologist, talk to a psychologist, so that they can verbalize their fear, they'll definitely be anxious, they'll definitely be scared, because it's like a new life entirely. Giving them a new diagnosis, they'll be like, God, how are they going to be able to manage this? So they need to talk to a psychologist, they need to um express themselves. So when someone is having a diagnosis and gradually falling into maybe depression, maybe anxiety, then they can come up with some mental or emotional signs, or physical sign. The mental or emotional sign can come in form of fear, anxiety, while the physical one can come in form of, they can just start sweating previously, like excessive sweating and all of that. So I will talk about depression briefly. Depression is just a medical condition that brings the feeling of sadness, and this person that is depressed will lose interest in activities that they love to do before. Maybe the person enjoy cooking, baking, and all of that. Once there is depression, you just see that the person does not really have interest. The person has lost interest, and you know that this is what this person liked doing before. The person would lose interest, and the person might not even be able to function at home, like at work, at home, anywhere. The person might not be able to function. The person will be withdrawn to self. The person will just want to stay on their own. So let's now imagine someone that has diabetes and is depressed at the same time. So it can be really overwhelming. But then these two conditions can actually be treated. It can be managed. I don't know if we can get the cure anytime soon, anyways, but then it can be managed. But it can be the medication can be taken alongside with one cannot disturb the other. If you are taking antipsychotic drug and antidiabetic, it does not disturb each other, so you can take it. And one thing is that if one of the condition gets better, maybe is the diabetes that get better, the mental illness too will actually get better. And if it is the mental illness aspect that get better, yes, the diabetes too is actually going to get better. Like there will be a drastic change. And mind you, mental illness can actually lead to diabetes too, and diabetes can lead to mental illness. So it's vice versa. Some medications that are used in mental health to treat mentally ill patient can also predispose them to having a mental illness. So I'll talk briefly about the signs of depression. I've said it while talking, but I'll just list it out. There is withdrawal to self, there is feeling of sadness, there is feeling of hopelessness. This person can just say that I don't have a future, I don't think this life is for me, I don't think I'm called out to be this and all of that. Then there is apathy. Apathy is just like having two different feelings towards the same thing. You will like it, at the same time you will hate it. So that's what apathy means. Then there's loss of interest in activities that this person enjoy doing, something that this person cannot do without doing in a day. They just lose the interest. When you call them, come now, come and join us, they'll be like, I'm not interested, and this is their area of interest. So there is reduced sleep or inability to even sleep at all, difficulty initiating sleep, and they might find it difficult to concentrate. Maybe if they are talking to them, they would lose concentration. They will not even hear what the person is saying. So they'll just lose concentration. Some of them will not eat. And some of them, they'll be eating excessively just to cover up for it. Then some of them will be having suicidal thoughts. This is the extreme point, when there is suicidal thoughts, suicidal idea, and some of them make attempts that this life is just, I'm not wanted here, people does not love me, that kind of thinking. And there is at times obvious weight loss. So if any of the sign is actually observed, that means this person is going through a phase of depression and needs to seek help as soon as possible, because taking care of diabetes might be a little bit stressful. You have to remember the time to check your um blood sugar. You have to record it just for future reference. You have to take your medication, your diet. You have to stick to the plan that the dietitian has made for you. So all of that can be really, really stressful too. So it's good and advisable that these people seek help at early points. Then stress, I will talk about stress and anxiety, like I said earlier now. So stress is like a normal thing that we face. Even the situation of Nigeria now going stressful for us. So stress is just like a normal body reaction to events around us that is happening. So we just need to learn to manage and cope with stress. Most of us, we work and work. We keep stressing ourselves, keep stressing our body, and we don't rest. We don't take time to rest. It's not supposed to be so. Stress can actually come in different form, like I said, emotional form, maybe relationship, family, um loss of loved ones, or anything. It can come in any form. So, but we need to learn how to manage our stress. We need to learn to cope with our stress. Look for time to rest. Don't be Some people too, they sit in their office, they go in the morning, from their room there is AC, to the car there is AC, to their place of work there is AC. So it's basic, they are just sitting down basically. That is not actually good. It's good to be very active. It's very, very good to be very, very active, to burn out and they keep eating. They keep eating, so the glucose keeps storing in their body, not finding anything to use it for. So I'll continue with stress. Stress will prevent you from taking care of yourself. It will prevent you from, at times some people will just, for people with diabetes now, they'll forget that they have not checked their blood sugar that day. They'll forget that they have not taken their medication. Normally, even ordinary anti-malaria, we forget at times. So they have to be intentional about it. But when there is excessive stress, continuous stress, they might start forgetting that, oh, I've not checked my blood sugar today, I've not taken my medication today, and this is going to lead to complication of diabetes if they continue like that, and can lead to other health conditions. So then there is anxiety. Anxiety is a feeling of worry, a feeling of fear that people have. Anxiety can be mild or severe actually. But anxiety, it might be a normal body response, but then the length of time at which the anxiety lasts matters. Okay, you are anxious, you wrote an exam, you're anxious of the results. Once the result is out, good or bad, the anxiety is supposed to go. you know you stop feeling anxious that, okay, I've seen my result, this is where I got it wrong, I can do this, I can do that. So but when it becomes, more than that, that means it's something else. That means it's indicating mental illness. I'm supposed to say this earlier. Mental illness is divided into two. There is minor mental illness and there is major mental illness. So when we talk about anxiety falls under the mental illness, but depression can actually be categorized under major mental illness, because there are a lot of risk, especially suicidal risk, for some of our patients. So people with diabetes, they have higher chances of being anxious every time. Maybe when they want to check their blood sugar, especially for those that their blood sugar is always extremely high. They're always feeling like, I want to check my blood sugar now. I don't know what reading I will get and all of that. So they're always scared. They're always scared. So they need therapy. They need people to always talk to them that having diabetes is not the end of life. It's not the end of life. You can manage this condition. You just have to be intentional about it. You just have to be obedient to what your healthcare givers say, the team together. You have to be able to do what they say, the pharmacist, the dietitian, the nurses, the doctor, whatever you are being told to do. If you can do that, then you can manage it. So they need that therapy, and they need to be able to they need this reassurance that, yes, you can talk to us, you can talk to us, you can express yourself, and we would not judge you. Yeah, we won't judge you when you talk to us. So people with diabetes can unnecessarily get anxious, and anxiety and stress can actually affect the level of blood glucose in the body. So for anxiety, you can get your mind off it by doing some activities, maybe like jogging, walking, doing yoga, meditating, talking to people, maybe friends or family, someone that understands you, that is not a source of stress to you, not someone that you will talk to that will add to your stress. and you become, more anxious. So you need to talk to people that you know that they are of like mind with you. Then limit alcohol intake, limit caffeine intake. In fact, I would advise that alcohol and caffeine should not be taken by people with diabetes at all, at all. Then anxiety at times might not really be mental illness, yes, because when there is low blood sugar too, low blood sugar, the signs and symptoms that comes up might be similar to that of anxiety. So it can be an indicator to low blood sugar. So you just need to check your blood sugar to be sure that, okay, it's not because my blood sugar is low, that's why I'm anxious. So that way we'll be able to know that, okay, um my anxiety is due to mental illness or low blood sugar. So I want people to know that as long as um we are alive, every situation that happens, we need to have the spirit of resilience in us to be able to stand up to the situation that yes, it happens, I'm going to go through it, and I'm going to go through it stress free. It might not be that easy, but yes, just encourage yourself that yes, I'll go through this. And that's why it's actually advisable to have a psychiatrist or a mental health counselor. Talk to them every time. When you are overwhelmed, let them know. Just express the way you feel to them. Just let them know this is how I feel, and they can talk you through many of those life situation, and you'll be able to get help. Well, diabetes diagnosis can feel like a threat to health, and it can feel like threat to a person's life. Managing diabetes with your day-to-day activity, restriction on eating some kind of food, especially the ones you love taking. you know so for someone that likes to take all of these carbonated drinks, all of these junks, categorize them as junks. Suddenly you are telling the person that, this is now a new timetable you have to follow. Somebody that does not follow timetable before now have to start following timetable. It can be really, really stressful. The person can be anxious that, I'm not. There's some food that maybe they have not tested before in their life, and they have to start taking it because of a new diagnosis that came up. And they'll be like, I've not tested this thing before. How will it taste like? Would I be able to continue eating this thing? Will I not default? Will I not? So now I would like to talk about diabetic stress. Well, diabetic stress is it has a bit of symptoms from stress, depression, and anxiety combined together. But unlike, the only difference it has with depression is that diabetic stress is caused by the presence of diabetes in the body. But depression can actually be caused by anything. It can be caused by anything, actually, ranging from life circumstances to health to finance and everything. So, but for diabetic stress, it's caused by by the underlying condition, that's diabetes. So some people will have significant worry that, my blood sugar can be low, my blood sugar can be high. How am I going to know when it is low, when it is high? I have to keep checking. And then there's this burden, this financial burden. They have to buy strip, and strip is kind of expensive. They have to, okay, let's start from glucometer. They have to get glucometer, they have to get strip whenever it runs out. They have to get the insulin for those that are taking insulin, and those that are taking oral hypoglycemic too, they have to get it. So the money aspect can be so, when they think about it, it can cause stress for them, that where will I get this? I have some other things that I have to do with money and all of that. This one coming up, adding to it, family, friends, and all of that. So it can lead to what we call diabetic stress. Then diabetic stress can also be caused by external factor like lack of support from family. Someone is just diagnosed, and the person is trying to tell the family that this is it, and they make it look like this is the end of life for you. Why will you do this? And it's not the person's fault, actually. So they might not really have a good social support and health support. They might not be able to go to the hospital as at when due, because they don't have money to actually do all of these things. So all of this can actually contribute to diabetes stress. So I wrote, yeah, risk factor to developing diabetes. Like I said, excessive stress, genetics can also be a risk factor. Sedentary lifestyle like obesity, alcohol use, tobacco use, lack of physical exercise, sitting down in one place from morning to night, eating a lot of different things without working it out. Autoimmune diseases too, like disease that cause other is like a disease in the body that wage war against other sorry, I lost I lost my so it's like a degeneration, like the body is fighting itself. Yes, that's what I was looking for. The body is fighting itself, is identifying some part of the body as a risk to the body and is fighting it, so it's destroying it. That's autoimmune disease. So there are some medication too that can actually cause it, and health conditions too that actually cause it. There are some antipsychotics too that can cause diabetes, like I said earlier. Example is clozapine. Patients with clozapine and olanzapine actually have high chances of developing diabetes. There's some patients with schizophrenia. Okay, so for treatment of diabetic stress, it's important to incorporate the help of psychologists, psychiatrists when taking care of a diabetic patient. Just like when the dietitian, pharmacists come together, the doctor, the nurses. So it's important that there's a psychiatrist to talk to them through their treatment and everything. So lastly, I would like to say that mental illness is treatable, just like diabetes. Both of them, they have their treatment, although it might be a lifetime treatment, but as time goes on, either the drug dose is reduced, or they have to just, for psychiatry, they might be able to take injection that will last them for 3 to 6 months. Then they might not take oral, but it take a long while to actually get to that level. So having diabetes is not the end of life. Actually, there are other therapies that can be used: family therapy, cognitive behavioral therapy, talk therapy can be used, and there are medications that can actually be used for managing depression in diabetic patients. Because of our time, I won't be able to talk much about that. I'm so sorry I've spent more than my time. Thank you, Nosdi.
Thank you very much, Penny, for that elaborate discussion on mental health and diabetes. As a matter of fact, um, I said it when you were about to start that last year when we had this kind of program, we did not really consider mental health, but over the course of the last year, interacting with people with diabetes, I realized that diabetes stress, like you mentioned, is a very serious issue. People are becoming very anxious. People are becoming depressed because of the burden that diabetes comes with. And it's something that we really need to talk about. So we've talked elaborately on the things to watch out for, the signs to watch out for, and how to help manage it if you are currently experiencing any of those. Very key things she mentioned is the need to seek for help, right? Mental health
Yeah.
issues cannot just be swept under the carpet. Seek for help and you will be able to get over whatever challenge you're facing in the management of your diabetes. And thankfully, we are also doing something to support people who are living with diabetes currently. If you've got diabetes or you have a family member who is living with diabetes, you can send them the link, right, to this. I'm going to just show it right now to the support. You can get either a free 1 month supply of diabetes drugs, or you can get okay, I'm going to show the banner at the end of this. You can get 1 month supply of diabetes drugs, whether oral or insulin. We've gotten generous donations from people who care about people living with diabetes, right? So you don't have to die in silence. You don't have to suffer. You don't have to. We understand the impact of this, and we're doing everything within our means to support everyone that God would give us the opportunity to help. So you can share this with someone and let them know about it. Okay. Thank you everyone who has been a part of this. Thank you. Seen a lot of people coming in and going and coming and going the past 2 hours. You've sat with your computers, phones, listening and just doing a lot of stuff. And I really appreciate you all. Thank you. Thank you, Ayobami from Lagos. Thank you, Mrs. Chineye. I can see, just mentioned a number of people. Thank you, Mr. Alaba Arulo. Thank you very much for your comments. Thank you, Mr. Isaac Abegunrin, for your comments. Thank you, Yusuf Sanusi. Thank you, Sir Timosa Vidya. Thank you. He's watching from the United Kingdom. Thank you, John Akosile, for joining us. I hope I pronounced that right, and everyone who joined us. And I want to especially thank all of our speakers. Thank you, Dr. Timmy, for doing this again with me this year, sharing from your wealth of experience and your very limited time to talk to everyone about diabetes. I'm so grateful for accepting to do this. Thank you. Yeah, and thank you to my wonderful brother, the pharmacist, Igbaboyemi. Thank you very much for accepting to also come up stage to share a lot. If you missed those sections, you can always watch back. The video will be up for as long as possible, as long as YouTube exists. So you can find it on YouTube, you can find it on Facebook, all right, and you can always watch later on. Okay, so you can read through the information scrolling on your screen. If you want to join this diabetes education and support group, it's a small group where I get to interact with people closely and just to help them manage their diabetes better. If you are having any challenge, questions, I connect you with people who I believe will be able to help you. Right? It's just that kind of support group. If you've got any, if you want to join, the link is up there on the screen showing. You can join us. Okay, and for the event, for the support program, like I said, you can find it. You can find it. You can join. You can get that information. It's on this channel. I mean, on our Facebook channel, you can get it. Our Facebook page. The flyers are up around. If you want to just know that bit.ly/, I'm going to just put it from bit.ly/ diabetes support 2023, and you'll be able to see the form and you can fill it. You can fill for someone if you think they won't be able to see it. You can just fill for someone who doesn't have access to the internet or phones, and help them to get this information and support. All right. And if you've got any questions, I have been able to extract the questions we've got, and I see that we've answered them. All right. And I think there are no other questions. So I'm just going to allow you to watch something briefly, and then I'll come back and we would completely end the live stream. Thank you again for joining me, to all my wonderful speakers who have done this with me today. Thank you very much. Thank you very much. Thank you very much for doing this with me. All right. So, you. So these are some information that will help you. I believe you can just Watch 9 ways to avoid complications. Some of the things you need to do: control your blood sugar, keep your blood sugar. This is a summary of what we have discussed today. Eat healthy diets. Be sure to be very active every day. Do something active. You don't need to go to the gym. Just stretch your body, walk, take a walk around. Control your blood pressure. Keep your blood cholesterol level low. Talk to your doctor about that. Check your feet every day. These are some of the things you need to do. Check your feet every day. That's very important. The feet and those parts of the feet that has been shown, there are pressure points that can easily get sore. And once it gets sore, it's difficult for the body for it to heal, because once you're having diabetes, that challenge also shows up. All right, check your feet every day. And then let's talk about how should somebody who is having diabetes eat. We say eat small portions of food per time. Snack on fruits when hungry. Avoid junks as much as possible. Replace carbonated drinks with water. I always advocate for water. Water is safer, it's the best. Stick to a routine schedule for your meal. Our dietitian explained that already. Reduce food with high calorie. Check your labels and know much about that. All right. There's some things I have to put here. If you're treating blood sugar, it is very important to treat it, because it could lead to very serious complications, like can harm your eyes, can cause nerve damages, and your kidneys can eventually get damaged. Okay, if you need to test for diabetes or even pre-diabetes for anyone who is above 35 years, and if they consistently have tests that reveal high fasting blood sugar, blood glucose, you need to see a doctor. Okay, because diabetes also puts you at risk of some heart rate hardening. You might want and that can also lead to heart attack, heart failure, stroke, and other things. You want to keep an eye on your blood sugar very well. This is it. The first step to controlling blood sugar is to eliminate harmful fats, eat healthy diet, and get help to lose weight where necessary. Okay, I'm just going to um, if you're using insulin, this is another important thing to note. If you're using insulin, that you should keep it away from sunlight, never keep it exposed. Okay, there are so many other things that we can get to know more when we interact together closely in the small group, in our support group. So you might want to just follow the link showing on the screen already to join. Okay, and finally, I'm going to be playing going to be playing this for you, where you can just know more about All right. Thank you very much, everybody. Once again, thank you very much to all those who have joined us. Please subscribe to this channel, follow us on every platform so that you can continue to get very helpful, useful, valuable content. If you're living with diabetes or you have someone around you who is living with diabetes. Okay, so it is important to get support. If you need to join a support group, we are available to help you further. Just if you if you can't follow the link, you can drop a comment and I would pick it up from there with you. Okay. Thank you very much. And once again, I thank all those who have joined us from the beginning until now, and especially thank all of my wonderful friends who have decided to join me on the speakers stage today. And thank you all. Thank you all. All right. I'm going to let this play, and at the end of it, would end the stream. Okay. Bye bye.